So, what did the doctor say to the patient suffering from a bacterial infection? He said, "Ah, I see you're a man of culture as well." Did you hear about the bacterial outbreak in the office? They said it was a staph infection. Last one today. I took a video of my symptoms that suggest that I have a bacterial infection. It actually turned out to be viral. Very good morning, everybody. Dr. Ryan here again, and this is going to be our final algorithm in internal medicine and our third in infectious disease. I hope that you guys have really benefited from these series of videos and that we are all growing as physicians. All right, a big thank you to those who've been liking and sharing my videos and subscribing to my YouTube channel. And of course, I encourage us to get the message out so that we can get as many subscribers as possible so more people can benefit from the material and the concepts that I've been sharing. Okay, so today we're going to try and break down 28 diverse etiologies behind meningitis. Let's talk to this for a bit. So meningitis is inflammation of the meninges associated with pleocytosis. Symptoms of meningitis include headache, neck stiffness, neck pain, lethargy, confusion, which is usually not prominent in the initial course of the illness, nausea, vomiting, photophobia. Physical findings of meningitis include fever, knuckle rigidity, Kernig sign, Brzezinski sign, papilledema, and other signs of raised intracranial pressure, example, a 6-nerve palsy. Some physical findings may be specific to the underlying organisms, example, the macular rash and the petechial skin rash of meningococcemia. Now, encephalitis refers to inflammation of the brain parenchyma, characterized by neurological dysfunction early in the course of illness. Meningoencephalitis is used to describe cases with clinical features of both meningitis and encephalitis. Meningitis, as we know, can be viral, bacterial, fungal, or aseptic. And the CSF profile, which basically means the opening pressure, the white cell count, the protein concentration, and the glucose concentration, can be useful in distinguishing between the various causes of meningitis. CT imaging of the head should be obtained before LP in patients who have increased risk for the presence of a mass lesion with raised intracranial pressure. So, breaking down meningitis, a handy way to do it is first up to say whether it's viral, bacterial, fungal, or aseptic, and bacterial will be further certified to typical versus atypical as always. So viral causes, remember, enterovirus, herpes simplex virus, which is abundantly common in our clinical setting. HIV can also cause it. Less commonly, lymphocytic choriomeningitis virus, arboviruses, and mumps. Bacterial etiologies, here we speak to typical versus atypical. So typical, we look at the usual cases of Streptococcus pneumoniae, right, Neisseria meningitidis, and this is the one that causes meningococcemia, right? Haemophilus influenzae, Listeria monocytogenes, Staphylococcus, and gram-negative backslide. Atypical simply meaning that it's very difficult to culture in routine culture media. So think about mycobacterium tuberculosis, especially in patients who are immunosuppressed. Right, spirochetes like Lyme borreliosis, Mycoplasma pneumoniae, Coxiella burnetii, Brucella rickettsia. Then fungal etiologies, Cryptococcus, especially in those who are present with advanced stages. HIV, stage 3, stage 4, with low CD4 counts and high viral loads. Histoplasmosis, blastomycosis, coccidioidomycosis, aspergillosis, candidiasis. Right? Aseptic forms, medication-induced meningitis, malignancy. So there we speak of lymphangitis, carcinomatosis, connective tissue disease, especially in the setting of neurolupus, okay, and parameningeal infection. So it's coming in from an adjacent structure, usually like a dental abscess or a subdural abscess, or cavernous sinus problems. Okay, here is just a handy diagram to remember, emphasizing the importance of antibiotic resistance and how important antibiotic stewardship is in terms of our selection of antibiotics, right? So here we're looking at the bug, which becomes like super mutant strong, and this is because of selective pressure, and they develop mutations to kind of bypass the mechanisms that our immune system uses to combat infection, okay? And they're super strong. And this bug is saying, "You're next," and smacking on our white blood cells and stuff, and and our body is saying, "We've created a monster." So rather, I think this could be antibiotics. Sorry, it's crushing the antibiotics, right? And so it says overprescribing antibiotics encourages the emergence of superbugs that are resistant to treatment. And we can think of a whole host of these drugs in our clinical setting. Okay. So as always, an OSCE question: a 35-year-old has recurrent aseptic meningitis, right? Blurred vision, painful reaction to loud noises, speaking to, hyperacusis, and the skin changes shown here. So what is the syndrome called? So you can see here, we can see hypopigmented kind of macular patches on the forehead, on the back, over the shoulders. So they got a lot of weird syndromes here. Right? I must admit, I have never heard of some of these. But actually, the answer that we're looking for here is called Vogt-Koyanagi-Harada syndrome. Okay, let's talk about this for a bit. And this diagnosis requires no history of eye trauma or surgery, but at least 3 of the following: chronic bilateral iridocyclitis, posterior uveitis, often associated with retinal detachment, tinnitus, neck stiffness, cranial nerve palsy, CSF pleocytosis, or other CNS disturbance, alopecia, poliosis, or vitiligo of the face or scalp commonly. And in 90% of patients, poliosis or clumps of whitened hair develop in the midst of normal colored hair. Piebald eyelashes, that is, clumps of white eyelashes in the midst of normal eyelashes, are shown in this case. Yeah, you can appreciate that here on the top. And no, he did not use bleach. Patients may also have hearing loss, vertigo, dysaceusis, headache, drowsiness, nausea, vomiting, dysphagia, and confusion. Most patients present between the 2nd and 5th decades of life. Ophthalmic consultation should be obtained. The pathogenesis is unknown, but is thought to be related to T-cell mediated autoimmunity to uveal or retinal antigens. And with immunosuppressive treatment, 2/3 of patients obtain vision of 20/40 or even better. So guys, this is my final opportunity, this being my final video, to encourage and motivate you. And I just want to quote a few scriptures for you, right? The book of 2 Timothy, chapter 3, verse 1-4. Pay attention to this. It says, "But mark this, there will be terrible times in the last days. People will be lovers of themselves, lovers of money, boastful, proud, abusive, disobedient to their parents, ungrateful, unholy, without love, unforgiving, slanderous, without self-control, brutal, not lovers of the good, treacherous, rash, conceited, lovers of pleasure rather than lovers of God, having a form of godliness but denying the power thereof." All right? And, this is what we see these days when we look around. People just, have no regard for God anymore. People are lovers of pleasure and lovers of themselves. Well, let's look at what John chapter 3, verse 16 and 17 says. It says, "For God so loved the world that he gave his only Son, that whoever believes in him shall not perish but shall have eternal life." Verse 17 says, "For God did not send his Son into the world to condemn the world, but to save the world through him." Romans chapter 10, verse 9 says that if a man confesses with his mouth and believes in his heart that Jesus Christ is Lord, he will be saved, him together with his household. John 14:6, Jesus Christ says, "I am the way, the truth, and the life. None comes to the Father but by me." John 11:25 declares, "Behold, I am the resurrection and the life. He that believes in me, even though he is dead, yet shall he live. And he who lives and believes in me shall never die." So my friends, I just want to encourage you that the only way to salvation is through Jesus Christ. And this world as we know it is going to pass away. And Jesus Christ is coming back to claim those who believe in him unto himself. And I pray that it will be the desire of our hearts to seek him and to know him and to serve him. All right. And I pray that you have been blessed, and all the best with your careers. And I hope that the information that I've shared on this channel thus far has been beneficial and helpful to you. Please do not hesitate to leave any comments in the dialog boxes below this video. Please don't hesitate to contact me. I look forward to hearing from you. God bless you, and all the best for the future.